Sawasdee ka, and good afternoon. Welcome back to the English language summary of the daily press briefing on the COVID-19 situation, live from the Center of COVID-19 Situation Administration, or the CCSA. I have lots of updates to give you today, so let me start right away with the new confirmed cases and the new statistics for today. So on the screen you will see we have quite a large number of confirmed cases today. We've reached a new high again. We have today new confirmed cases standing at 2,839 cases. The majority of them at 2,523 cases are from local transmissions. There are 304 cases that come from active case findings and 12 cases from state quarantine. So that leaves us at a new accumulative cases of new confirmed cases at 53,022 cases. We also have new recoveries. They stand at 377 persons. And the active cases that are still being treated at medical facilities stand at 22,327 cases. So we have now the total recoveries accumulated remains at 30,566 persons. Now on to some very sad news. We must report to you today that we have reached another new high. We have today 8 new fatalities. And that brings us to a new accumulative number of fatalities standing at 129 cases. So just now, Dr. Tuisin had reported to us the specifics of each fatality. So the 122nd fatality was a 48-year-old male from Samut Prakan province who was already diagnosed with obesity. The 123rd fatality was an 83-year-old female from Bangkok who also had diabetes, high blood pressure, and suffered from hyperlipidemia. The next fatality, 124th fatality, was an 89-year-old male from Bangkok who was already bedbound and had suffered from colorectal cancer. The 125th fatality was a 63-year-old male from Bangkok who had a history of high blood pressure and gout. The 126th fatality was a 68-year-old male from Chak Cheong Sao province who had high blood pressure and also hyperlipidemia and also from cardiac arrhythmia. The 127th fatality was an 82-year-old female from Samut Prakan province who suffered also from cervical cancer. And the 128th fatality was a 75-year-old male from Nakhon Sawan province who also had high blood pressure and hyperlipidemia and also benign prostate hyperplasia. The last fatality, the 129th fatality, was a 62-year-old male from Nonthaburi province who was suffering from chronic kidney disease. So the CCSA would like to express our sincerest condolences to the families and friends of the deceased who passed away recently. And we can see that most of these fatalities were all cases that already had underlying illnesses. Some more observations from new cases today, it seems that the top 10 provinces with the highest statistics of COVID-19 still remains in Bangkok as number one, with a total of 1,582 cases. The rest of the provinces in the top 10 remain with about 100, over 100 cases, or slightly with double digits. So these are Chiang Mai, Chonburi, Nonthaburi, Samut Prakan, Pathum Thani, Samut Sakhon, Surat Thani, Nakhon Sawan, and Songkhla. Dr. Tawisin also kindly concluded, summarized the meetings from this morning's meetings. We summarized that the new infections that have happened in the past few weeks continue to come from some causes that have continued to happen even before. And so it means that we probably need to still be more vigilant and cautious. These reasons actually are still from the workplace or offices, and also from family units, from the gatherings and their dining together or their socializing. There are also particularly gatherings of elderly people. Also, patients continue to be reluctant in providing truthful information of their timelines of activities, which has complicated case findings and case investigations and contact tracing. And also, this was also because due to the after effects of the clusters that originated from entertainment venues, which continue to result in new infections. What's very concerning are the continued high-risk activities, such as, like I mentioned, these entertainment venues, which we will closely monitor. And if necessary, the CCSA will consider the possibility of maybe imposing more stricter measures, but this is only if and when necessary. I'd like to also give a recap to the English language audience who probably might not have understood. What happened last night was that the Prime Minister of Thailand addressed the nation via television broadcast. And this was televised, of course, in the Thai language. So allow me to recap last night what the Prime Minister addressed to the nation yesterday as we continue our fight against COVID-19. He advised to everyone that we need to continue to be high on guard and strictly observe public health measures as advised by the CCSA to control the spread of the virus in light of the high number of confirmed infections in the past few weeks. Some important points in his address were that he had confirmed and assured that the government had been consistently assessing the situation and has tasked several government agencies with improving the capacity of Thailand's public health system to address the ongoing situation and to speed up the process of vaccine procurement and inoculations of the population across the country so that we may soon recover from this ongoing pandemic. The government is also accelerating the rollout of the vaccinations and has already administered vaccines to risk groups to more than 900,000 persons, half of whom are medical personnel and frontline workers. On vaccine procurement, the Thai government is moving fast to procure 100 million doses of vaccines to inoculate the target of 50 million people by the end of this year. So far, we have already procured 60 million doses, which come from which comprise of 61 million doses from AstraZeneca. These are to be delivered in June. 2.5 million doses from Sinovac, of which 2 million doses has already been delivered. And today, the remaining 500,000 doses will be delivered to Thailand. In addition, the Chinese government has donated another 500,000 doses of vaccine to assist Thailand's fight against COVID-19. And as for the remaining 36 million doses, the government has been successful in procuring 5 to 10 million doses of Russia's Sputnik V vaccine and another 5 to 10 million doses from Pfizer. And next week, the Prime Minister will meet with representatives of 3 entities from the private sector. And these are the Board of Trade of Thailand, the Federation of Thai Industries, and the Thai Bankers Association. And this is to hear their views and discuss the collaboration with the government on vaccine procurement and how to administer the vaccinations to the targeted population of 50 million people by the end of the year. The Prime Minister also reiterated that the government stands ready to treat COVID-19 patients with a stock of 300,000 tablets of favipiravir tablets, which is used to treat COVID-19 patients, and has distributed this reserve nationwide, and we are already in the process of importing 2 million more. The government has already provided 28,000 beds in hospitals, field hospitals, and hospitals to treat COVID-19 patients and those at risk. And as the number of COVID-19 cases have surged in the past few weeks, the government is preparing additional beds and medical facilities to take care of all patients. Economic relief and stimulus packages will also shortly be implemented to alleviate the economic difficulties faced by those whose livelihoods have been adversely affected in the result of the pandemic. And lastly, the Prime Minister expressed his gratitude to the public for their understanding and cooperation, which is vital to overcoming this pandemic. He also offered encouragement to all medical personnel, all village health volunteers and frontline workers who have made incredible personal sacrifices and have tirelessly dedicated themselves to public service and fighting COVID. And that was the gist from the Prime Minister's broadcast last night. I'd like to turn your attention now to some very urgent news. We have learned that blood donations are urgently required at hospitals across the country. The Thai Red Cross Society has urgently issued an appeal for blood donation because blood supplies have dropped dramatically since the latest surge of the COVID-19 infections. The National Blood Center Director said that donations have plummeted to 2,000 units per day since early April. So this does not correspond with the demand at more than 340 hospitals nationwide, which is roughly a demand of about 6,500 to 7,000 units. So because of the pandemic, this has forced the cancellation of many blood donation drives, and so it's becoming a great concern for the treatment from other patients who are not suffering from COVID but from other medical issues who desperately need blood transfusions. So we would urge anyone who is ready and able and healthy enough to come over and donate blood at any Red Cross facility or any hospitals right now. Also, since the 24th of April today, Nonthaburi province has announced some measures that is probably necessary for many of you to know. First of all, these are more stringent measures to help curb the COVID-19 spread. First of all, the provinces ask the public not to participate in group activities of more than 10 persons. Residents are advised not to leave their residence from 9 p.m. to 4 a.m. The provinces also ask the public to refrain from drinking alcohol in public areas. And all sectors are asked to work from home where possible and to refrain from eating food together or dining or gathering or socializing. And of course, mask wearing is now compulsory. Anyone found without wearing a mask in public areas will be fined. And that fine is 20,000 baht, so quite hefty. So I'd like to close by reiterating that we have experienced today a new high in the number of confirmed COVID patients, and it is apparent that the situation has not yet improved. Most of the infections continue to come from the workplace, and they also come from family units, from dining, from socializing, from high-risk activities, and particularly patients who have not been forthright or honest in disclosing their timeline of activities or movements to facilitate thorough contact tracing. And this has complicated investigations for disease control authorities who are already working very hard and racing against time to find the origins of each infection. So in this last slide, I have some infographics for you on the screen from the World Health Organization explaining the importance of contact tracing. So contact tracing helps to identify times and places where people have had contact with someone who has contracted the COVID-19 virus. Contact tracing also helps inform people who have been exposed to the virus, and it also helps isolate people with COVID-19 to prevent further spread of the virus. Contact tracing can help break the chain of transmissions, and therefore, when you are infected with COVID-19, please inform all medical personnel. We have our hotlines ready always, and you must also inform your whereabouts, your travel history. It is a responsibility that you make these reports as detailed and as honestly as possible. It is a responsibility that every individual bears as a member of society. The more honest you are, the more you can protect those around you and save lives. Well, that's all I have for you today. Thank you for your kind attention. Have a happy Saturday and see you again tomorrow. ขอบคุณค่ะ สวัสดีค่ะ
ครับขอบคุณนะครับท่านผู้อำนวยการกองประมวลและวิเคราะห์ข่าวกรมสารนิเทศกระทรวงการต่างประเทศนะครับคุณเพ็ญโสมเลิศสิทธิชัยนะครับ